Yeah, on the bill, and Assemblyman McKeon and I agree on probably 90% of it, and I think it's a shame on the 10% that there seems to be the disagreement on the Horizon bill. I think the restructuring is a good plan. I think it's a very fine company that employs a lot of people and has done a very good job providing health care throughout the state of New Jersey. And when the sponsor said they are giving us $600 million, they are us. There is no they. That $600 million is from the policyholders, whether it be privately paid, county government, state government, private sector. This is on the $600 million, and I agree with my colleague Nancy Munzo on, this should go back to the policyholders. We've seen the state get in trouble. The times we've gotten in trouble is the raid on the unemployment trust fund when we use those funds for other purposes. On the transportation trust fund, both of which had to be corrected by the legislators afterwards and done into constitutional amendments. Here we're taking money out of it, which is the sole purpose to provide good, reasonable as possible health care, and we're taking the $600 million. And I got to be honest, if this was in the private sector, this would be called a shakedown or a shakedown by organized crime. But in this case, it's not organized crime shaking down Blue Cross Blue Shield. In this case, it's the government. And it's really a shame because on both sides of the aisle, whether you're a conservative, a moderate, a liberal, I think and I hope that all of us believe the most important thing is affordable health care. This $600 million could go so far in giving folks in New Jersey a more reasonable premium, or at the very least, if you want to do this deal, we should have allowed them to maybe agree to freeze rates for a year or two. And I don't blame Horizon. They have no control over where this money is being directed. But to go into a black hole, go into General Treasury when this money was spent and paid for to provide good quality health care to the New Jersey residents is just wrong. And like I said, I'd like to be able to vote for this bill on a restructuring and bringing them up to the times when I get the cap. But to take this $600 million and not have it earmarked for health care or to stabilize rates, I think is just wrong. And just to reiterate what I said, when it's they making the $600 payment, that is us. That is the policyholders, whether you're private paying or corporate or government entity. And this would go so far to putting a dent in keeping health care under control. And I just wish that the restructuring could be separate from the $600 million. And I urge my colleagues to vote no on this, to take policy's money and misspend it and not direct it towards health care and costs or lowering the health care costs in the state of New Jersey. And it's also ironic we're doing it during the worst pandemic and one of the worst medical crises that this nation has faced, as we all know too well. And to be taking this money and not using it for health care is a little mind-boggling to me. And thank you, Mr. Speaker, for the time.